All right, everyone. Well, welcome, everyone. Very nice to meet you. Good evening. I'm going to go ahead and turn on the share screen here so you can see my presentation. Well, wonderful to meet everyone. Thank you so much for taking the time this evening and from your busy schedules. I'm going to admit another student here. And this is the session on undergraduate programs for the College of Health. My name is Dr. Eduardo J. Gómez, an associate professor in the College of Health, and I'm also the director of undergraduate programs here in the College of Health. And if you could please ask your questions at the end of the session tonight, either use your speaker or use your chat, whichever one. And thank you so much again for taking the time, and I look forward to speaking with you soon. Let me go ahead and get started. So our Bachelor of Science degree program is the first in the world to provide an undergraduate degree in population health with a focus on health innovation and technology. This is a 124 credit hour program to prepare students to investigate the determinants of health using data science and to identify novel and effective avenues for disease prevention, health promotion, diagnosis, and intervention. Our BS program is a four-year program and entails the following course structure. You start off with a distribution requirement, which is 18 to 22 credits. And this entails courses such as English 001, Critical Reading and Composition, or English 002, which is also Research and Argument. Also Social Science classes, 2 of those, and humanities classes, 2 classes there. And those are some broader distribution requirements that you can use in classes. You usually start taking in your first year. Then we have core classes, which are 39 credits. And those include Introduction to Population Health, which is an introductory course that everyone has to take in our degree program that introduces students to a variety of topics in population health. Learning from cell to society, learning about social determinants of health, all different ways of studying population health. We then have population health research methods and application, which provides you more in-depth methodological background for research and how that applies to the field of population health. We then have the history of population health, which is a course that I teach that looks at a historical perspective of population health, looking at the rise of particular communities and diseases and responses to these population health outcomes, the rise of international institutions, domestic governments, in response to population health issues, all again from a historical perspective, asking what can we learn from history in the area of population health. We also have the biological basis of population health data science 1, 2, and 3, which provides rigorous scientific background in the area of population health, and also methodologies and methods in epidemiology. But we also have several seminars that you need to take for 6 credits. 3 are predetermined and 3 are additional. They include population health, ethics in population health, writing about science, and also design thinking for innovation in health. And there's some other ones that you can take later on as well. But we also have concentration courses. So towards the end of your degree, you can decide on what area you want to concentrate in. And these are 12 to 16 credits minimum. 4 courses are required. 2 must be above the 300 level. And you can concentrate in several different areas. These are just some examples of what you can concentrate in. And that's what you can specialize in with your degree towards the end. And again, this is in consultation with your advisor that you'll be provided. The first one, for example, is epidemiology and biostatistics. Another one is community health and population health, environmental health, health innovation and technology, global health, which is my area of research, looking at how other international organizations and governments are responding to critical population health issues, social and behavioral health, health policy and politics, which is my area of expertise, looking at how policy is created and the political factors that go into that in response to population health. And of course, that's very relevant today in COVID-19, of course, but also indigenous studies. And so these are all some possible concentrations that you can look at. But we also have, for you students that are interested in going into medicine, we have a pre-med track. And so what this entails is a different course sequence when you enter. You'll start off some core courses such as Introduction to Population Health, Ethics in Population Health, but then you'll include some classes in mathematics such as calculus or science such as Introduction to Chemical Principles. And again, based on what your level is, and this is a more specialized track for those of you that want to go into medical school. If you do want to go into medical school, we have a special office called the Career and Professional Development Office, and they're the ones that work with us and you to prepare for the MCAT or answer any questions you may have about preparing for medical school. And also you can enroll in their pre-health advising course site. Here is the email address. You can contact them, and if that's something that you want to do, you can contact them. They're a very professional, wonderful office. We've had meetings with them, and they're very helpful in terms of working with students and preparing them for the MCAT and preparing them for med school in general. But we also have several certificate programs, and these are the current and planned undergraduate certificates. Our current certificates are a Global Population Health and Population Health. We also have planned the LGBTQ Health Certificate, Indigenous Studies Certificate, and Maternal and Child Health Certificate programs. The Global Population Health and Population Health certificates all require 16 credits. With respect to the Global Population Health, the course what you would do is you would take required Introduction to Population Health. You would take a Global Environment and Human Welfare, a seminar, and then an internship or research project either here in the US or in another country, working with a community or a government or an NGO on a particular population health issue. You would also need to take an upper level class, a 200 level or above, chosen in consultation with your advisor. For the population certificate, population health certificate, and again, this is more for students that are outside of the college, you would be required to take an Introduction to Population Health class, a seminar, Population Health Data Science 1, Methods in Epidemiology, and an elective in consultation with your advisors. And so this certificate programs is a wonderful way to you to specialize in certain areas, sort of similar to a minor. And we're really excited about these programs and happy to answer some more questions about that if you have any. But we're also very excited to announce the 4-1 BS MPH program. So now you can enter into our BS program and earn a MPH within 5 years. This allows students to earn a BS degree and an MPH in 5 years instead of the traditional 6 years, usually 4 years as an undergrad, and then 2 years as an MPH student. Students apply to the College of Health and indicate an interest in this 4-1 program. The process includes an essay question and an interview with one of our faculty in the College of Health. The acceptance into this program is announced on April 1st, and once you're admitted, students have to maintain a GPA of 3.0. And work towards your MPA begins in your senior year. And so we'll be working very closely with you and making sure that you're on track and doing well and preparing for your MPH, which start working on towards in your senior year. We're very excited about this program. I think it's going to be very great for students that are interested in pursuing that, and look forward to answering any other questions you may have about that. But some of you may be interested in going abroad in international studies. And one thing that I regret when I was a student as an undergrad is I never went overseas to study how other countries work. And so we have a lot of opportunities for you to engage in international studies. And the most popular one seems to be the study abroad option that is run by the Office of International Affairs. And this is several different options for you to go overseas and study abroad for different time periods at universities. At Lehigh, we have wonderful partnerships with several universities throughout the world. And so that's something that seems to be very popular with students here and may be popular with you. We also have the Global Citizenship Program, which you apply for in your sophomore year, and you go overseas with a group of students. It entails a curriculum to study different topics. And you can, of course, potentially look at population health issues in other countries. But we also have a very strong United Nations partnership. I don't know if many of you know, but in 2004, Lehigh became an official NGO with the United Nations. It's recognized by the United Nations as an NGO, and that of course brings a lot of recognition to us, but also we have this wonderful program, United Nations partnership, and do a lot of activities in the UN. So possibly in the future, you could go to the UN and sit in on some sessions on population health or global health or a lot of different things. And so we've actually been talking to people that work in that program, and it's very exciting and a wonderful opportunity. But in addition, we have faculty that are working across the world and have partnerships in several different countries around the world. For example, in Latin America, we have, I myself work in Brazil, been working in Brazil for many years, the start of my career in Brazil. We have connections in other countries, Venezuela, in the US, of course, but we also have faculty working in other countries overseas, in India and Russia and Asia, working on projects in these areas. And we have new projects that are coming, will be developed in Africa and developing partnerships there as well. So we have a wonderful group of faculty that have their footprint overseas, and happy to discuss that with you at another point. And certainly in the future, you could possibly work with our faculty and going to do some experiential learning or possibly engaging in some research projects with them. For example, I'm looking forward to going back to Brazil or Mexico, where I've been working recently on the commercial determinants of health and looking at the population health and obesity, type 2 diabetes in particular populations. And so if that's of interest, we can talk about that. It's just one possibility of what could possibly be done in the future. Okay, now, what do you do with your degree once you have it? Of course, all of you must be wondering, I have this wonderful degree in population health, a Bachelor of Science from Lehigh. What can I do with it? Well, there's several career paths that you can take with our degree. And this is what I love about our degree, is there's many options that you can do. First is the private sector. You can work in the consulting division, working on population health issues and a variety of population health issues. Health technology, of course, that's the future of population health. And we are experts and going to continue expanding in the areas of health technology, which is our expertise. And so, there's wonderful opportunities there in that sector. Pharmacy, for example, is another area that you could possibly go into the private sector. But there's also other options in non-for-profit, such as working for professional societies, for example, or the disease-focused organizations, such as working on heart disease or obesity, specific non-for-profits that work on particular areas of population health. And there are a myriad of different examples of these kinds of not-for-profit organizations. You can also go into academia. Go into a tenure track position like I am in a university. You can become a professor of population health. You can also go into a non-tenure track position focusing on research or teaching, but you can also go into pursuing advanced graduate degrees in health or medicine or related field in population health, or in PhD in population health. So there's a lot of different things that you can do in academia with our degree. And I think our degree gives us a strong foundation in population health, and sort of being able for you, it allows you to go into various different areas in academia, which is really exciting. And finally, you can go into the government, working for local governments, state governments, for example, the health department, Pennsylvania State Health Department, working on several population health issues. You can also work for the federal government, the CDC or Department of Health and Human Services, or even perhaps the State Department working on global population health issues. I mean, the State Department has a wonderful, area in the area of global health, but also international organizations. You could work for the United Nations, the World Health Organization, the World Bank, where I used to work at previously, PAHO, the Pan American Health Organization that works in the Americas. And certainly our degree is so relevant, so important. The World Bank and all of these organizations have been working on population health for a long time. We also have organizations such as the Global Fund to Fight AIDS, Tuberculosis, and Malaria, which also takes a very interdisciplinary interdisciplinary approach to population health issues. And so these are some of the various careers that you can pass, that you can take in population health. And one of the wonderful things about our degree program is that it prepares you for these different careers. It provides you with a strong scientific, methodological, health technology, data science, analyzing data. All of these tools will make you very marketable and very successful in a wide variety of different kind of careers. And so happy to answer any other questions you may have about that. Well, that's all for my presentation this evening. And once again, I'm very excited that you're all here. If you have any further questions about, declaring a major or a certificate, please contact me at any time here at my email address, or you can contact Sherry Boos, who's our senior administrator, if you're trying to find any forms or on how you may want to be interested in declaring a major or certificate. Always very welcome to answer any questions you may have, an email, and any follow-up questions. And just so excited that all of you are so excited about our program. And I'm happy to open up to any questions you may have now about our program. Thank you. So feel free to use your microphone, or you can ask any questions in the chat.
I have a question.
Sure.
So I'm a freshman, so I applied into the College of Arts and Sciences, but I'm interested in transferring to the College of Health potentially. Do you think that that would be like a transition that would be possible?
Sure, that's possible, of course. Taking some of our, you're required to take our core courses, but yes, that's possible.
Great, thank you.
Sure. Any other questions?
I have a question. So what
Sure.
are some things that you can minor in within the College of Health if you are also getting like a business, you're majoring in something for business, like something along like economics or math?
So you're asking if you can minor in something in the College of Health?
Yeah, like what are some of like the opportunities that they have, that you guys
Sure.
have?
Well, we have the different the certificates that I mentioned. You have the Global Population Health, the the Population Health certificates, and you also have the other ones. Child and maternal health, the LGBTQ, and also the indigenous study certificates. And those are sort of our majors, or our minors that you can possibly, the certificates are sort of our minors. And so those are the ones that you can possibly follow at this time.
Okay, thank you so much.
Sure. Any other questions? You can ask any questions also about what population health is, or anything about the degree, or any other activities, or no other questions?
I have I have another question.
Sure, sir.
So, you were like showing us the concentrations or whatever, like with the global health and like epidemiology, like those things were listed. So how is like global health different than population health, if that makes sense?
Sure.
Like,
so global health looks at healthcare, population health in other countries. Looking at different countries, Brazil, India, China, looking at the international organizations and international communities. So studying population health issues and the multiple determinants of population health in other countries. But you can also look at, certain communities in the US as well, where high-level immigrant populations. You can also look at, international organizations in the US, like the United Nations. But global population health looks at population health issues in other countries, mainly applying our interests of population health in the US to the same kind of topics in different countries. And looking at the different multiple determinants of population health in other countries. So that's what really distinguishes. And also involved in that is issues of culture as well, society, politics and institutions in other countries. And so that's what differentiates global population health from population health.
Okay, that makes sense. Thank you.
Sure. Any other questions or general interests? About population health in general or in careers maybe? No other questions? Okay, well, if there are no further questions, once again, please feel free to contact me at any time. And I'm very happy to answer any questions. And I look forward to possibly hearing from some of you in the future. And I wish you all a wonderful evening and weekend. And thank you so much again for taking the time to come out to this session. And very best wishes with everything. Thanks a lot.
Thank you.
Take care.
Thank you.
Thank you. Bye-bye.